Welcome to RWJBarnabas Health's Health Talk Show. I am Dr. Douglas Ashinsky of RWJBarnabas Health Medical Group. Regular pediatric visits are crucial in monitoring growth and development and allow for early detection of potential health issues in children. On today's show, we will learn more about the full range of pediatric services, including preventative care, urgent care, and specialized care that RWJBarnabas Health provides to ensure children's diverse health needs are met. Thank you, Dr. Furrer, for being here. First, for the audience, can you tell us a little bit about your background and how you've gotten to RWJBarnabas Health?
Sure. You know, the funny thing about it is I grew up in New Jersey, and I lived in Essex County until I was into my 20s. And then I left the state initially to go to medical school. I went to medical school in Georgetown. I was fortunate enough to serve in the United States military for about 4 years. I went to Navy diver school and participated in Desert Storm. And I think that's really relevant because a lot of the principles of high reliability and quality and safety that are so important in medicine are things that I learned at an early point in my career. A lot of those originated in the military. I went back and I did my surgical training in part at UConn. Then I migrated to Hopkins, where I did my pediatric surgical fellowship in pediatric urology and reconstructive surgery, and also did a research fellowship. I spent 16 years after that at UConn, Connecticut Children's Medical Center, where I sort of ascended the ranks and was fortunate enough to participate in creating a significant division, and had an active research career and was a PI NIH funded in molecular biology research. Along the road, other things intervened, and I became surgeon in chief of the Children's Hospital. That led to becoming chief physician executive and leading the Physician Corporation. And I developed a real interest in healthcare delivery and healthcare systems. I was undecided, and after 16 years of still operating, having a research lab, and doing admin, I took a position that was going to really put me in sort of a second-in-command role of a freestanding children's hospital. And that was in the Midwest. I did that for about 2 years, and then was fortunate enough to be recruited to Mount Sinai, where I led and reorganized children's health care for the Mount Sinai Health System in New York City. I was at about approaching the 5-year mark there when I was approached by the Rutgers RWJBarnabas Health system. And I was intrigued by the academic-private collaboration and intrigued about what that platform could lead to in the way of changing the way children's healthcare is delivered in New Jersey. I've always had family here. It was an opportunity to come back home, and to be honest with you, I became enamored with the idea of helping my home state and being close, obviously, to a lot of people that my wife and I care about.
Thank you for that, and thank you also for your service to this country. Let's start with the general overview of the children's health services offered at RWJBarnabas Health. Can you tell us a little bit about the organization, the networks?
Yeah. So, you know, by the numbers, it's the largest provider of children's health care within the state of New Jersey as an organization. There are 4 principal campuses, at least, where inpatient work occurs. The Bristol-Myers Squibb Children's Hospital in New Brunswick, the Children's Hospital of New Jersey, located within Newark, Beth Israel. Then there is the children's programs that are at the Cooperman Barnabas campus in Livingston. And then last, but certainly not least, the Unterberg Children's Hospital in Monmouth. Those centers serve as hubs for inpatient care. They all have intensive care units. Beyond that, there is a vast network throughout the state of ambulatory sites where our subspecialist and primary care doctors practice. And then when you go beyond that, you'll find that there's a growing network of primary care providers. At last count, I would say, whether employed or affiliated through a joint venture, there's about over 108 pediatricians affiliated with the system. So upon arrival, it was obvious to me that they had a large presence and a large platform from which to build programmatically.
Also, pediatric rehab and long-term care hospitals also.
I didn't jump into that right away, but one of the most amazing things about this system is to say pediatric rehab, I would say to you, they have an entire pediatric rehabilitation hospital on the New Brunswick campus, children specialized. That is nationally recognized and unique. I can tell you in the Mount Sinai system, when I would look at my patient throughput and what we would call the tail end of care after the acute phase was over, I dreamed of having a platform like the Children's Specialized Hospital to provide kids that wraparound care from the acute hospitalization to the next steps of their care and recovery. So that is a tremendous asset to this organization. I also didn't mention that there's a very significant behavioral health presence within the system as well. That's something that's really important in children's and adolescent healthcare today, and it's another building block towards creating a really well-integrated system of care for kids.
It's got everything. It's got the outpatient docs, outpatient specialists, the acute hospitals, the rehab hospitals, tertiary and quaternary care. It's got the full gambit of care.
Mm-hmm. Yes, it does. Absolutely.
So what are the biggest challenges you see in delivering pediatric care?
There are a couple of challenges that are common in the industry right now. And by common, I mean our system's not immune to them. There is a dramatic decline in the number of physicians interested in pursuing careers in pediatric and pediatric subspecialty care. It's risen to a point at this point in time where the American Academy of Pediatrics and the American College of Graduate Medical Education are all making statements about this that are public. So I think that one of the challenges facing our system moving forward is the talent gap, quite frankly. And the need to be extremely competitive in being able to recruit talent. There are literally some healthcare deserts where you can't access some pediatrics people in this country. And certainly as we move forward, we don't want to wind up in that situation. That's a challenge that faces all of us. The other challenges that are facing all of healthcare right now is the incredible shortage, not just of physicians, faculty, but also of nursing and all of the other super qualified people that work in healthcare, from x-ray technologists to dietitians to social workers, so on and so forth. That's another industry challenge. We all know that that has led to appropriate demand for increase in pay and improvement in working conditions in these groups. And at the end of the day, that of course has ripple effects for the economic ecosystem of a hospital system, particularly a large hospital system. And that's another issue that we need to manage to be sustainable. When you get to the question of what the more unique challenges for our system in our state is, children's healthcare is becoming increasingly complex. And what I mean by that is, if you looked at data of projections of what the outcome of the new RSV vaccine will be, and those are really exciting, it suggests that it may decline admissions for respiratory syncytial virus by up to 20%. That is phenomenal. It is part of a growing pattern that the people that require admission into children's hospitals, the children that require admission, are very complex, oftentimes have more than one condition, oftentimes have multiple congenital conditions. So the case mix index is increasing. In other words, complexity is increasing. And as a consequence, the demand for higher level beds, more ICU beds, and in fact, having care teams and multidisciplinary care teams that are experienced in taking care of these really upper echelon tertiary or quaternary care kids is increasing. And we have to shapeshift our platforms to be able to meet that need and provide the kids from New Jersey the care that they deserve. The fact of the matter is, it's data that's readily available. For that very high-end care, there are many New Jersey families that choose to leave the state and go to one of the, let's call them destination children's hospitals that are in our region at tremendous cost and inconvenience to them. So we're paying a lot of attention in the system as to charting a future that would meet those needs for our families. On the other hand, I'll go back to a common need. We see today that there are multiple areas in pediatrics where we have an opportunity to impact children lifelong. Diabetes care, obesity, developmental issues. And in fact, some data from our underserved points to inadequate asthma care. These are all things that if we develop comprehensive programs and can address these problems early in childhood, will lead to a healthier future and healthy lives. This story is not a new one. This is a common problem across the United States. In some cases, it's more common in underserved areas where there's less access. And we're also very focused on how do we address those needs, particularly of those underserved populations, to give them the brightest, best, and healthy future. So those are some of the challenges that the industry is facing, but also some of the issues that we as a healthcare system are focused on after taking sort of a look around us and saying, where are things going and what is New Jersey going to need?
It's good that you have your head in this and going through all of that. And at the same time, leadership at RWJBarnabas is going through the same thing with that. The implementation of a full system Epic EMR is going to be very helpful, that they'll be able to pull a lot of the data out of that and be able to, on the fly, make changes in order to get some of the care teams, et cetera, done, move people around, move patients around, move providers around, move nurses around. So by implementing something like that, that really does show that they're looking for that. At the same time, numerous RWJBarnabas Health facilities were named among the nation's best children's hospitals in 2024 to 2025 by U.S. News and Health Reports. Can you tell us about those recognitions? You know, I don't know if the people understand how important it is that we are such a good system.
Yeah, and again, that was part of my attraction for coming here. You know, to be able to take a system that's already made the choice to focus on those areas of need and is already performing well, to be able to join a system like that is a real pleasure, right? Because you really feel like they've got it right. I would say that pediatric healthcare U.S. News and World reporting is really different than on the adult side. And it has changed dramatically over the years. At one point in time, it was very reputation-based. It was very subjective. But they brought a lot of objectivity to it. And in many ways now, U.S. News and World Report for Pediatrics is almost, I would say, a statement about quality, safety, and commitment to providing the highest level of care. We are nationally ranked in two really large specialties, pediatric urology and orthopedic surgery. That distinction really requires that you really have a very broad focus. Those rankings don't just come from the individual specialty themselves. The hospital rankings dramatically affect the specialty rankings. So quite frankly, it's a statement of something being done right. And I would tell you that we are very focused, not just on the rankings that we get in two specialties right now, but I'm so pleased to be part of a system that's focusing so much on the other aspects of the survey and making sure and driving towards having all of our specialties be amongst the top rank. But it is really an indicator of best-in-class performance by the RWJBarnabas healthcare system.
It just shows the accomplishment. It's a testament to the tireless dedication of the whole team. As you said, the care team, the physicians, nurses, staff, researchers. Now, how is RWJ ensuring, you had talked about equitable healthcare access for children in underserved communities?
Yeah. We're right now working on a strategic plan that looks forward from a really good position already. We have multiple programs directed at these populations that are actually showing some amazing results. We have a collaboration with one of the insurance companies. It's based out of our Newark platform. And it is a collaboration that addresses asthma care for children and addresses making sure that those kids get the follow-up care, follow-up appointments, and medication compliance that will keep them out of the emergency departments and keep them out of crisis. I was just speaking yesterday to one of our physicians who has done an incredible program, led an incredible program that's resulted in a very large gift, making sure that post-birth care for kids and issues such as in-crib safety are met. It's ingenious. It's a onesie for babies that actually has front and back lettering on it that or writing on it that describes what appropriate positioning for the child should be. So there's a lot of innovation being brought to this. The agenda items that we're working on right now similarly focus on early intervention and monitoring of children with diabetes, because we know that early management of those conditions prevents end organ damage. We're also very interested in focusing in obesity. A lot of changes are happening in obesity care. At this point in time, some of the new drugs are becoming more widely available and utilized in children, and utilized appropriately, they can have a big impact and be part of our armamentarium. As you know, changing obesity is another lifelong paradigm shift for your healthcare in terms of taxing your organ systems, your skeletal structure, so on and so forth. And then beyond that, we're in discussions about children with developmental needs. Again, another group that early intervention can make a big difference in. We have a very large developmental pediatrician program at Children's Specialized, and we're looking very carefully as to how we can expand access in underserved areas.
So we're conducting social determinant screening, which is a non-medical screening focusing on the physical environment, the clinical care needs, behavioral and social and economic needs. And our care management teams also are closing the loop so that the families do receive the resources and care that's needed. It's something that's so important.
Yeah, and to go back to something that you mentioned before, I was just on a meeting the other day with the EPIC people in Wisconsin, making sure that we're bringing to bear the greatest pediatric utilization of EPIC. And quite frankly, social determinants of health is something that, again, a electronic health record can be of great assistance with. We're also, I'm really proud of something else in our system, working with Andy Anderson and Amy Cotton at the system level of quality and safety. We're completely advancing pediatric quality, safety, patient experience, and equity in what we call a pediatric quality and safety consortium, where we bring all of the individuals, key leaders from all of our institutions, where we transparently review our results against national benchmarks for the various inpatient, surgical, neonatal, quality and safety programs, and where we also look at our patient experience and also look at our equity in terms of taking care of our patients. This is something that we've been working on feverishly for the last couple of months, and I could not be more excited about it. I was at an event last night with Andy Anderson, our CMO, and we were talking about how much pleasure and joy it brings us in the system to bring that focus on pediatrics and those various aspects of pediatric outcomes, quality and safety and equity in a specialized way. That's really unique. A lot of healthcare systems have a lot of trouble bringing that focus to pediatrics because, again, as a percentage of what the entire health system does, although it's critically important, it's not something that's easy to get people's attention to, and that is not the case in this health system.
Let's move on now a little bit because we're coming to flu season, flu and respiratory season. Can you tell us about RSV and why it's so common in children?
Yeah, RSV is a what I would call an annual scourge that has comes to visit us and is very active sometimes between the months of, let's say, November, December, February, March. It's a viral upper respiratory tract illness, particularly vulnerable are young children. It's very easily spread. It's very contagious. And children under the age of 2 are, let's say, not as robust, so they're more vulnerable for it. You can really make an impact on this by getting your child vaccinated. The new RSV vaccine is proven to be safe, and quite frankly, is we think, going to have a major impact. The other population that you hear of all the time is the older adult population is now susceptible to RSV as well. So this is a great time to visit your pediatrician, your primary care doctor, and talk about RSV and how the new vaccine can protect your child, and does your child fall into a category that would be really beneficial to immunize?
Is there treatments for RSV?
The prevention is the treatment, like a lot of other viruses. Fundamentally, you can treat symptoms, you can treat bacterial superinfection. The fact of the matter is there are some immunologics that target viruses, but really for RSV, the best thing is prevention, which is a lot of hand washing, a lot of isolation if you're sick to prevent others from getting sick. And the vaccines are really the way to go. If your child has
Is there a monoclonal antibody available?
So yeah, there are monoclonal antibodies out there that can be preventative as well, and you can talk to your pediatrician about those and see if your child would qualify for those. There's a multitude of options is coming forward right now, but early interaction with your primary care doctor to see what preventative measures your child would qualify for are what we recommend.
Both pediatricians and internists need to be pushing the RSV vaccine as much as possible, especially in the November through March. And those of us who see the 65, 75-year-old people need to tell them about it also, or the person who has asthma, diabetes, because if they've got kids or if they are, again, grandparents who are watching their kids so that the parents can go to work, they're easily susceptible to it.
That's a really important point. And what I would say to you is multi-generational households, it's not just a pediatric issue, it's a whole family issue. And you're absolutely right, particularly those with other comorbidities over age 65, all should be talking with their primary care doctors as to whether they're qualified. I'm really happy that you brought that up because, again, we are living in a world where with fully working families, there are a lot of grandparents that are providing day-to-day childcare, and you want to keep them healthy and safe too.
Now, do you have partnership with Rutgers Health?
Oh, yeah. We have, that's part of the excitement for me. As you know, I'm an academic physician by training, and we have a very robust partnership with the Rutgers University healthcare system. Quite frankly, we are constantly having conversations about our training programs, how to expand our training programs. I mentioned to you before the predicted shortages in pediatric subspecialists. One of the best way to address those shortages in your region is to train people that then want to stay in your region, because that frequently happens. So we interface with them actively in the development of training programs, making sure their training programs are competitive vis-a-vis others, and that's training of medical students, residents, and subspecialty fellows, which is something that we want to increase. On the research side, there's active collaboration going on as well in various areas. And little known fact, there's a ranking system for pediatric departments. It's a ranking system based on your extramural funding, NIH funding. And Rutgers University Pediatrics last year was ranked 30th in the nation, which is very respectable. We'd love to see that increase further.
Hopefully I will, especially since we've welcomed some highly qualified pediatric surgeons, as well as the physician-in-chief at BMSCH.
Oh, we have had a very successful recruiting season. Our new chair of pediatrics at Bristol Myers Squibb Children's Hospital, quite frankly, I've been fortunate enough to be at some of the better institutions in our country. Our new chair could be a chair at any one of these institutions. An accomplished record as an academician, publishing papers, a lengthy list of mentoring, and an attractant for new faculty. Same on the surgical side. Dr. Steve Stylianos, who comes to us from being the surgeon-in-chief of Morgan Stanley Children's Hospital at Columbia, a long history of publication, training, a lot of activity and quality and safety for kids, and we're really hoping that he's going to help us down the path of getting certified by the American College of Surgeons as a Level 1 center for children's surgery.
Unfortunately, we're at the end of this talk. It's been wonderful, all of the things that you bring to RWJBarnabas Health, and hopefully we'll have you on again to go through more of what you're bringing into this healthcare community. Is there any key messages before we leave?
Yeah, so what I would first of all, thank you very much for having me. It's been a pleasure. A couple of key messages are, we are working hard every day to make ourselves the preferred provider of pediatric care in the region. And the other message would be, coming into the season that we're coming into, please take the time to check with your pediatrician, your family doctor, whoever your primary care provider is. Ensure your child is up to date on immunizations and all of those methods and techniques that can be used to keep your child safe and healthy. We're here to help.
Thank you very much for your time. Thank you very much for everything you do for RWJBarnabas Health. And thank you for being part of this.
Absolutely, my pleasure. I'm privileged to be here.
That concludes today's episode of Health Talk. Please remember that the opinions expressed here today by our medical experts are not a substitute for medical advice from your own physician. If you need a physician, please call 888-724-7123. For more information about RWJBarnabas Health's Children's Health Services, please visit www.rwjbh.org/children's health.